Hi, everyone. Thank you for joining us for our AmeriCorps Member Assistance Program orientation. We are going to go ahead and jump right in and be talking about how you can access benefits for the AmeriCorps Member Assistance Program, also referred to as MAP. As we get started, if folks want to take a moment and say hi in the chat box with your name, program, and where you're joining us from. We have a pretty small group today, so please don't hesitate to ask any questions as we go. Feel free to use the chat box to share any questions or comments. You can also raise your hand, which you can find the raise your hand button under the reaction tab, and that will indicate to us that you'd like to speak over audio, and we'll let you know that you could unmute to ask your question or provide your comment. My name is Rachel Bruns, and I'm the Chief Engagement Officer for America Service Commissions, also referred to as ASC, and I'll be sharing with you about how to access your Member Assistance Program benefits. I'm also joined by my colleague Monica Greenfield, who will be helping me to address any questions or comments. And so you might see Monica answering questions in the chat as well as we go throughout the webinar today. For those of you that aren't familiar with America Service Commissions, we are the national association for the 52 governor-designated state service commissions. State commissions are the entities that administer the AmeriCorps state program. So many of you may be serving at an AmeriCorps program that is funded through your state commission. Others of you may be at a program that is either an AmeriCorps National or AmeriCorps Vista program or other program stream of service. So welcome you all here, and we are happy to provide the Member Assistance Program, which we launched around 7 years ago. We launched it based on feedback that we heard from commissions and AmeriCorps programs that were expressing a lot of challenges in how they could provide affordable and accessible mental health resources to their AmeriCorps members. So you'll see that mental health services is a kind of primary focus of the Member Assistance Program, but we'll also be talking about some of the other benefits that are available through the program today as well. So jumping right in, I'm going to be first covering information on what benefits are available through the Member Assistance Program, and then I'll be transitioning to focusing more on like how to actually access those benefits as an individual that has this program available to you. So we refer to the Member Assistance Program as MAP. So you'll see that MAP language throughout the slides here. And the real core kind of focus of the Member Assistance Program is that it provides a free 24/7 and unlimited in the moment telephonic mental health counseling service. And this provides services for both you as an AmeriCorps member as well as any household members that may reside with you. So all the benefits that I'm going to be talking about are available to you as well as any household members. And I'll also cover information about some other resources that are focused on kind of well-being for you, as well as continued professional and personal development resources. All of the materials that you or resources you might access are confidential and voluntary. So we really encourage you to take advantage of these resources while you have access to them. Your program has paid to make this service available to you during your term of service. And so definitely encourage you to access these and know that they are completely confidential. No one else knows that you're accessing them as long as you aren't telling that to anybody yourself. If needed, there are translation services available in up to 140 languages. And so that's something you can request to say that you need language translation services when accessing services. And then all of the services that we are talking about are provided through our partner, All One Health. So ASK kind of facilitates this program on behalf of AmeriCorps programs throughout the country. And then we work directly with the provider, All One Health, who is delivering the services. Specifically on the 24/7 mental health counseling service that is provided by licensed master level counselors. As noted, this is available any time of day. You can call for any reason. And this is something that I like to emphasize. you can be calling because you have a specific issue that you want to speak about with a counselor, or it can be that, maybe you just had a difficult day and you want to talk to somebody about it. So there doesn't really need to be like a crisis. There doesn't need to be a specific identified issue. It can just be that you want to call and speak with someone, that day, or you could call every day if you really wanted to just have a go-to person or go-to support system via the member assistance program. Of course, if you are experiencing an emergency, we encourage you to call either 911 or other appropriate resources in your local community. But really know that whether you're in a crisis or just wanting to speak with someone about how your day went, can be a wide range of reasons to call. You can access the member assistance program for that type of support. So that telephonic mental health service is that core benefit that is available to everybody that has access to services. There is also a face-to-face counseling benefit as well, but this does vary in terms of if you have access to the benefit. That depends on if your program signed up for this specific level of services. So if you're not sure if you have the premium or premium plus package, you should check with your program director, or you can also reach out to us at the map@statecommissions.org email, and we can clarify for you if your program has access to face-to-face counseling. For face-to-face counseling, this includes either in person, so going to see a counselor in person, locally available to you, or it could be for video counseling as well. If you have access to this, then you can call the 1-800 number to request face-to-face counseling. They'll collect additional information from you. If you are wanting that in-person counseling, that can take up to 2 to 4 weeks to schedule based on counselor availability and your location. If you are looking for that video counseling, usually that can be provided a little bit quicker. They do sometimes use third-party vendors for video counseling, so no, they may connect you to another vendor outside of All One Health to connect you to that service. But through that intake process, by calling the 1-800 number, they'll get the relevant information from you on the type of issue that you're wanting support around, where you're located, what your availability looks like, all the information to help connect you to that face-to-face counseling. So again, if you're wondering if you have access to that or you're not sure, ask your program director or feel free to reach out to us and we can clarify that for you based on your program. Everyone has access to life coaching, which is another service available through the member assistance program. This is where you can call and request to have a life coach, and you will have up to 3 sessions available to you. This is really focused on working on achieving a specific goal that you're working towards. This could be personal or professional. On the slide here, you can see some different examples of what that might look like, but really up to you in terms of what you're wanting to get some support around from a life coach that will provide kind of a process to help you work towards achieving that specific goal. Another benefit that is available is called legal assistance. This is essentially a free consultation for up to 30 minutes with a qualified attorney. So I really say that the benefit here is this gets you kind of started on different resources and getting some insights from a qualified attorney on a variety of topics. So if you are kind of facing something that may benefit from legal advice or legal insights, calling the 1-800 number and asking to speak with an attorney via legal assistance can be a good starting point. They're not going to be your actual attorney, but providing some resources and information can be a good starting point for folks. You can decide to work with that individual, that attorney further, but there is a fee for that beyond the 30 minutes. So that's something to be aware of. A very similar benefit, but focused on finances, is called financial assistance. And in this case, there is no time limit on each issue or when you're calling. So this can be a really helpful resource if you're looking for support in a number of issues that have to do with money and finances. We know many individuals that access this benefit specifically around kind of student loan management, looking for support around budgeting and savings, and planning for life after AmeriCorps. So really encourage folks to leverage this support, and you can call and say that you're looking for financial assistance. They may ask you for some more specifics around what type of topic, and then they'll connect you with the appropriate individual, whether it's a certified financial planner, a public accountant, or a credit counselor to provide additional support. The next two benefits are very similar. They are called personal assistant, and then the other is work-life resources. Both of them are very similar in providing kind of referral information for you on a variety of topics. So, for example, if you're looking for someone to walk a pet for you while you are away for a short amount of time, you can call and ask them. I'm looking and say I'm looking for pet care or boarding information for an animal. Then they would basically do some of the legwork for you in terms of researching information on available pet care options in your area, provide that to you, and then you would determine what you might want to move forward with if interested. So this can be a helpful resource, especially if you don't enjoy that process of researching and finding information on different services in your area. The last benefit area that I'll review here is called medical advocacy. This is a resource that's available if you are navigating a healthcare challenge, or maybe you're supporting someone that is navigating a healthcare situation. You can call the 1-800 number and ask to speak with a medical advocate, and they can be available to support you in navigating diagnoses or help you figure out your healthcare coverage that is related to that diagnosis, and really just be kind of a neutral third party that helps you navigate that often complicated or complex environment. So again, a helpful resource if this is something you are navigating personally, or if you are kind of working to help someone else that may be navigating a healthcare challenge. I'm going to transition now to talking about how to access services. You've heard me refer to calling the 1-800 number a little bit. So that is a primary way to access services, and we'll share that number here in just a moment. Another resource is a website called mylifeexpert.com. There is a password to access the website and related resources, and we'll walk through that website in just a moment. But encourage you all to put the website on your phone, as you can save it as a mobile icon if you have a smartphone. So that can be a helpful tool to easily access the website resources, as well as access the 1-800 number. You can also save the 1-800 number on your phone. That number is 800-451-1834. And this can, again, just be helpful to have handy on your phone so it's easy to call as needed. I'm going to pause here and pull up the website to show a little bit of the information and resources that are available at mylifeexpert.com. When you go to this website the first time, you will be asked to enter a password. So you'll create your own account, enter the passcode, which is AmeriCorps, all lowercase, and then you'll create your login. And then moving forward, you'll just use your login and you won't need that passcode again. So once you enter the website, you'll see that there's a number of different web links at the top with different resources, but right on that right-hand side is the 1-800 number that I just mentioned. If you're looking at this on your phone and you click this, it will call the 1-800 number from your phone there. So that can be handy to have available, whether you're just looking at this as a web page or if you've saved this as an icon on your home screen somewhere on your mobile smartphone. So you can call for support right here at the 800 number to request any of the services that I walked through earlier. You can also use one of these forms, and this will, instead of calling the 1-800 number, you're essentially submitting a form request, and someone will get back to you on those requested services. There is a chat support function on the website as well. What I'll just flag is that this is not counseling support that you're chatting. You're talking to an intake person, and this is available during normal business hours. So this is very similar to submitting one of these requests via form. You might be able to chat with someone in the moment if you are asking a question about services. But if you're looking for that in the moment support, and I'll stress this multiple times, but if you're wanting to talk with a counselor like right now, we always recommend just calling the 1-800 number and saying that you want in the moment counseling support, because that is the quickest way to get connected with the counselor. They will have counselors available 24/7 to connect you with services. There are a number of other resources on the website that we encourage you to explore on your own time, including webinars that are live that you can register for. So you can see their upcoming webinar on June 11th on teamwork. You can also see a list of other upcoming scheduled webinars for, you can see several scheduled over the next couple of months. So if you want to attend any of those, you can simply click on register now to receive the login information for that webinar. If you are interested in a topic that is scheduled but can't attend that date, you can find all the recorded webinars on this related web page. So most everything is recorded and made available on the website later on. And then there's a number of other resources you can explore that are specific to both personal and professional development. So the last kind of couple things that I will mention as it relates to the accessing of services is we do want to note that when you are calling the 1-800 number, your kind of first kind of engagement will be with someone that is on the intake team for All One Health. And this is an important step in the process to access services. So when you call, they're going to ask you some important questions to help confirm what benefits you have available to you, as well as then to connect you with relevant services that you're requesting. So make sure that when you call that you're ready to provide your name and kind of basic contact information like your phone number. They want this so that, if they are connecting you with a service later on, they can obviously have that individual easily contact you via phone. In addition, they're going to ask you what your program name is or organization name. In this case, we encourage you to be ready to share what your AmeriCorps program name is. And this is the program name that is registered with us as part of enrollment for the program. If you're unclear about what this may be, again, encourage you to ask your program director what program name you should be providing when you call for services for the member assistance program. And this is, again, how they confirm what benefits you have available to you. If you are calling because you want that in-the-moment counseling, be sure that you specify this at that time to say, I want to speak with a counselor right now for telephonic mental health counseling service or in-the-moment counseling. And then they will ask you for a little bit more information, like what type of issue you might be calling about or what the topic may be. And the reason they're asking for that level of information as part of intake is they want to be sure to connect you with a counselor that is best suited to help address or support that issue or need. For example, if maybe you are calling because you're struggling with a substance use disorder, they want to connect you with someone that has a specialty in that area. Maybe you're calling because you're struggling with a relationship. They might want to connect you with a family counselor in that case. So it may not be something that is that specific, and that's okay. You can just say, I want to speak with someone because I'm having a difficult day. You can just provide kind of a general idea of what the issue is so that they can connect you with the appropriate counselor. So again, just emphasize, be ready to provide your program name and phone number. If you're wanting that in the moment support to speak with a counselor right away, be sure to clarify that so that they can connect you with someone as soon as possible. Those are all of the kind of prepared slides that we have for this orientation. I do want to encourage folks, if you have questions outside of our call today, to not hesitate to reach out to us at our map@statecommissions.org email. You can ask us questions about benefits and how to access them there, or just get some clarifying questions related to what benefits are available to you through your program specifically. So don't hesitate to email us. We also have a FAQ, frequently asked question document on our website at the page that's linked here on the screen as well. With that, I will stop sharing the screen and see if anyone has any questions for us on what benefits are available through the Member Assistance Program or how to access those services. So I'll pause there to see what questions folks may have. Not seeing any questions, but again, we'll just remind folks, I really encourage you to take advantage of the benefits and services that are available to you through the Member Assistance Program during your term of service. As I stated, your program is paid for these services, and all of the services I mentioned are free to you during your term of service. So this is a great opportunity for you to access these benefits while you're serving.
Excuse me, Rachel, someone did ask a question in the chat about getting support for applying for SNAP and other benefits.
Yeah, thanks for that question, Erin. I would say that you might be able to get some information on like where to be directed to those, but they're likely not going to be provided kind of specific kind of resources on applying for those government types of benefits. So that's something that does vary significantly state by state. So I would encourage folks to ask more about that via their program director or their state commission. Certainly can request referral information like those work-life resources. They might be able to provide some support. But I would say the Member Assistance Program is not designed to support applying for those benefits directly. And Nicole, the request counseling button on the website. So if you have access to face-to-face counseling, and again, we encourage you to clarify that with your program director or reach out to us and we can let you know it once if you tell us what program you're with. You can request counseling via that form and they'll get back to you for whether you're asking for in-person or video counseling using that online form. Yes, you can do that. That being said, we definitely encourage using the 1-800 number as kind of the quickest way to get connected to resources and counseling if that is what you're looking for.
And there's a couple of questions in the chat as well. Just
Yeah.
someone was asking about the Siegel Award and also will they keep us updated if funding is restored for AmeriCorps and what happens. I know I'm just asking that question for myself because this is my first time with AmeriCorps. I really enjoyed the program. I just wanted to find out what happens or how can we find out about updates if funding is restored and just a little direction because we don't really know.
Yeah, so to a couple questions there, Claire, thanks for flagging those. So Michelle, your question on the Siegel Award, the Member Assistance Program does not provide information on the Education Award. We are happy to provide information and answer any questions you might have on that. But the AmeriCorps agency website does have frequently asked questions for accessing your Education Award that I would direct you to. And if you give me a moment, I can pull that up and put it in the chat for you. We also have a presentation that Ask facilitates on using your education award that I can direct you to if you want to reach out to us if that's helpful. But the member assistance program is really focused on mental health services and related benefits and doesn't really go outside of that scope. So the benefits that I walked through throughout this presentation is kind of the scope and limitations of that program. The member assistance program also does not have information about kind of the status of AmeriCorps funding. That is something that if you're interested in learning more about, I encourage you to ask your program director. America Service Commissions also provides lots of updates and information on our website as well as our social media pages regarding kind of the status of funding. I'll remind folks too, I don't know the status of each of your programs as it relates to any recent grant terminations that may have happened. But there are many programs that have not been impacted by grant terminations and are continuing service at this moment in time. So if you have questions around that, I encourage you to ask your specific program. Any other questions that folks have at this time? And then I just put the link to the Education Award webpage on the AmeriCorps website that has some more information if you have questions on that. All right. Any other questions that I may have missed? Well, as we stated, encourage you to access the member assistance program for any support you may be looking for around counseling, specifically the 24/7 telephonic mental health counseling service. If you do have access to the face-to-face counseling, you can confirm that with your program director or reach out to us. And you have access to either 3 or 6 sessions, depending on which package is available to you. As mentioned, encourage you to use that 1-800 number to call and access services. And then all the other benefits I mentioned, you can access via the 1-800 or the website as well. Any other questions before we wrap up the call today? All right. Well, thanks everyone for joining us. We hope you have a great rest of your day, and please don't hesitate to reach out at our email map@statecommissions.org if you have any further questions. Thanks, everyone.